We're now live.
So good afternoon. Welcome to the 2020 Annual General Meeting of the Maidstone and Tunbridge Wells NHS Trust. This is our first virtual meeting in the current pandemic circumstances. And the meeting is being live streamed onto our YouTube channel and will be left on our YouTube channel after the meeting is over for any other interested parties to view retrospectively. I'm going to firstly take apologies for absence. Two of our non-executives, Emma Pettit-Mitchell and Richard Finn, were unable to make today. Claire O'Brien, our chief nurse, has sent her apologies and is represented by one of our deputy chief nurses, Gemma Craig, and our new interim director of workforce, Cheryl Lee, is also an apology. I'm then going to ask my colleagues to introduce themselves for the purposes of the YouTube live stream so that anyone watching knows who we all are. So over to you, please, Sarah.
Hello, I'm Sarah Dunnett. I'm a non-exec and I chair the Quality Committee.
And I'm Maureen Chung. I'm a non-executive director and I chair the Patient Experience Committee.
Hello, I'm Neil Griffiths. I'm a non-executive director and I chair the Finance and Performance Committee.
Hello, I'm David Morgan. This is my first AGM, having joined the Trust a year ago, and I chair the Audit Committee.
Hello, I'm Karen Cox. I'm an associate non-exec director and I sit on the Workforce Committee.
Hello, I am Jo Webber. I am Associate Non-Executive Director and I sit on the Quality Committee and on the Digital Transformation Board.
Hello, I'm Miles Scott and I'm the Chief Executive at Maidstone and Tunbridge Wells.
I'm Steve Alpin. I'm the Deputy Chief Executive and the Chief Finance Officer.
Hello, I'm Sean Briggs. I'm the Chief Operating Officer.
Hello, I'm Amanjit Jund, the Director of Strategy, Planning and Partnership.
Hello, I'm Pete Maskell. I'm the Medical Director.
Hello, I'm Gemma Craig and I'm Deputy Chief Nurse.
Hello, I'm Sarah Mumford. I'm the Director of Infection Prevention and Control.
Before we move into our presentation, I'd just like to ask all the attendees to be on mute if they're not speaking. Thank you. And during the presentation, it is possible to submit questions through YouTube, in addition to any questions we've received in advance. And Kevin, our board secretary, will moderate any questions that we get during the YouTube live streaming. So without further ado, I'm going to hand over to our Chief Executive, Miles, to give an overview of performance.
Thank you, David. So what I want to do is just say something about the commitments we made this time last year and how we've done against those. And from there to move on and just talk about what we're working on at the moment, what our priorities are, and what I'm expecting that we'll be able to say we've delivered this time next year. So if I can have the first slide, please. Last year we set out, I think, a really ambitious agenda for the current year. We started with wanting to make sure that we continue to develop services and facilities for patients here at MTW, so that we could both become and be recognised as an outstanding organisation. And I would particularly highlight a number of things on the right-hand side here. The reconfiguration of our surgical services, which has meant that we have now co-located our emergency surgery with our complex colorectal surgery at Tunbridge Wells Hospital, is really making a big contribution both to patient safety and to continuity of care for our sickest patients. At Maidstone, we built the new £8 million acute assessment unit, which was a really important part of our preparations for dealing with the ongoing increasing demand for emergency care, and had the added bonus this year, or the added benefit this year, of actually freeing up a space which we were then able to use during the COVID pandemic. I'll talk a little bit more about that in a minute. And then we were able to respond to probably the number one issue from patients across all of our services has been, over the couple of years I've been here, has been the access to parking. And we were able to use the financial strength that we've developed as an organisation over the last couple of years to build new car parks on both of our sites, so that we've really future-proofed our capacity. And we know what a big difference that makes to patients, that when they arrive on site, they're not anxious about where they're going to park, what time they need to arrive, and so on. This time last year, I was very straight with everybody that our biggest operational challenge was to deliver the NHS constitutional standards for cancer access. And in fact, if you went back just over a year, back to about 18 months ago, our performance as an organisation against the cancer access standards, particularly the 62-day standard we have to treat patients from urgent referral by their general practitioner, our performance was not good enough and was right at the bottom of the league table in the country. I'm delighted to say that we have now delivered those standards, and the 62-day standard in particular. We've now delivered that for 12 months in a row. We're one of only 2 trusts, we think, in the country that have delivered it every month for the last 12 months. We've maintained that throughout the COVID pandemic. And I think what's important to say here is that we've really changed the way we manage a lot of the treatment pathways for cancer patients, that mean that we're providing good care at the right time in a responsive way to those patients. And we've had lots of comments from patients about how much they appreciate the pathways, and also the confidence that they have in the services as a consequence of being seen promptly and by the right person. Huge credit goes to an enormous range of people within the organisation, from obviously doctors and nurses right at the front line, but also to our admin staff, to all of the support services that have enabled this to happen. And I would particularly also like to pay tribute to our colleagues in the clinical commissioning group, who really supported us where investment has been required. So this is a classic case of both redesign of services and investment, and that sheer will to succeed by our staff has led to a major improvement in services for patients. I've mentioned that demand for our services has increased year on year, particularly the demand for emergency care goes up every single year, and it's been really important that we redesign services to keep pace with that, and in particular working closely with colleagues in primary and community care, for example in frailty, to change the way we deliver services, in particular to deliver many more services on what we call an ambulatory basis. So that's enabling patients to come to the hospital, get all of the assessments that they need quickly by a senior expert in their field, and then where appropriate and where possible, enabling patients to go home the same day. And that's enabled us to keep our organisation flowing, and has enabled us to give them the right response to individual patients based on the conditions that they're presenting with. And then fourthly, our key priority I mentioned this time last year was around our workforce, and in particular around ensuring we had enough staff, especially nursing staff, and especially at Tunbridge Wells. And I'm delighted to say that we last year we recruited more than 4 times the number of trained nurses that we would normally expect to recruit in a year, and that made a huge difference to the quality of care for patients, and also, frankly, to the quality of staff experience in our organisation. As well as investing in staff and recruiting the right numbers of staff, we've also put a huge effort over the last year in making MTW as great a place to work as we possibly can. So we established our new Exceptional People Outstanding Care programme that's referenced here, and have worked very hard to improve the experience of our staff. And we've also, and as part of that, built on the excellent reputation that MTW already has for being innovative in developing new roles. We've been one of the first trusts in the country to develop roles such as the emergency department practitioners who work alongside senior doctors in the majors area of emergency departments, roles like the consultant scientists in cellular pathology, again a first in the country, the consultant radiographers both in therapy and radiography, that's oncology, and also in the diagnostic imaging function. So we've got a great track record there, but we've really built on that in the last year, particularly with the trainee nurse associate programme and physician associates, which means that we've got a sustainable pipeline of people coming into these important roles, and we're able to offer our own staff career progression. So that gives you a sense of some of what we achieved over the last year, and there's more detail in our annual report. I'd like just to say something now about how you might measure us in a year's time. What is it we're committing that we will have done and will have achieved? That means that we're continuing to move forward as an organisation, and we're continuing to improve our services for patients and the experience for staff. So again, highlight 4 things. I think the first thing inevitably is that the response to the coronavirus pandemic has dominated the last 6 months, and is going to be really important for us going forwards, particularly as we both juggle the potential for a second wave of coronavirus, along with the new approaches to social distancing, infection control, and so on, while also at the same time ensuring that our planned services are able to operate at their optimal capacity. Because, of course, if you go back to March and April, we essentially stopped all planned activity in order to focus on coronavirus. Looking forwards, we're actually restoring that planned activity, and we want to keep that going even in the face of the second wave, even in the face of a difficult winter. So that requires more change, more improvement, more redesign of services, more expansion of capacity. I've mentioned critical care capacity here on this slide, and also more change in the way we do things. So a particular feature of the future is going to be to continue providing more what we call virtual clinic appointments, and those are largely at the moment conducted by telephone, but increasingly in the future they will be through technology such as this. They'll be video appointments. Our second priority then is around our planned care, and in particular ensuring that we tackle the long waiters that have built up over a number of years, so that we can deliver the NHS constitutional standard of every patient receiving their first definitive treatment within 18 weeks of referral by a GP. That would in any case have been a challenging goal for us in the current year, but that that is made much more challenging by the experience of the last 6 months. And inevitably, we do now have a number of much longer waiting patients. So there's a lot of work for us to do there, both in terms of elective planned treatments, but also in terms of outpatients. And if the next year in clinical service terms is going to be about anything, it's going to be about transformation and improvement of our outpatient services. Third thing around that's highlighted here is around flow, particularly for our urgent and emergency care services. Our performance in this area is absolutely top draw. We see how we're able to measure flow, we're able to measure our response to the emergency care standards every week and compare ourselves with the rest of the country. We have consistently, week in, week out, been the best performing organisation in the South East and within the top 5 nationally. But that will only be maintained by continuing to develop our services, continuing to innovate, because the demand will go up and up and up. So we're going to be investing in additional medical staff and other clinical staff with a particular focus, especially in our medical specialties, of having senior decision makers right at the front door. And so our 7-day service program is going to be a really important development for us, and we will in many ways see a reshaping of hospital medicine with more senior people working across all 7 days of the week and over an extended period, in order to provide patients with that senior service when they need to access it. We'll also be introducing new pathways and new technology, and we have a new patient flow system that we're going to be introducing. And then fourthly, a key priority for us will continue to be to recognise and reward the efforts of our staff. Our staff have done the most amazing job throughout the coronavirus pandemic. We've really been extremely grateful and appreciative of the support we've had from local people, which has really helped us all to work through this very challenging period. And I think we've learned a lot about how we can better support our staff. It's quite clear that for us to be an outstanding provider of services for patients to get the best deal that we can possibly offer them, that has to be built on MTW also being an outstanding place to work. So we will continue to put great emphasis into that. So those are 4 big commitments and some more detail of what we will be progressing over the next 12 months. And I'm very committed to coming back in a year's time and being able to say we've delivered on our promise down on the bottom left-hand corner of your screen, which is MTW as an organisation that's all about exceptional people providing outstanding care. David, thank you very much.
Thank you, Miles. We're now going to hand over to Steve Orpin, our Deputy Chief Executive and Chief Finance Officer, to review the finance performance of the Trust.
Thank you, David, and thank you, Miles. It's my pleasure to present the financial performance for the organisation for the 7th time. It's always a pleasure to take us through, and it's also particularly pleasing because it's on the back of a good year's performance, which I'll illustrate as we move forward. Kevin, if you wouldn't mind moving on, thank you. So we have 3 main duties to deliver from a financial point of view. We have the cumulative break-even duty, which I'll describe a little bit more about on the next slide. We have our external financing limit, which is making sure really we stay within the cash envelope that we've got to work in, and our capital resource limit, which is a level of capital spend which we can work within to improve our facilities and replace our medical equipment. As you can see from the table here, we achieved the external finance limit, we achieved the capital resource limit, but unfortunately we didn't achieve the cumulative break-even duty. And as I say, I'll describe that a little bit more on the next slide. Every trust's break-even duty is normally measured over a 3-year period, and our last cycle, 3-year cycle, commenced in 2013-14. And because we hadn't met that duty by the end of that 3-year period, which was 2015-16, we stay in breach of that until we have got back into a sustainable position. As I'll describe a little bit more fully in a moment, we did deliver a surplus last year of £7 million, which exceeded our control total and helped to reduce the cumulative deficit accordingly. And our cumulative deficit now just stands at around £30 million. The important part is that that's reduced by £28 million over the last 2 years. So we are reducing that cumulative deficit and looking to bring the trust back into cumulative break-even in future years. So we are on the right track and making progress. But until we get back to that cumulative break-even, we will stay in breach of that duty. I've mentioned already the bottom line financial performance of the trust, which was a surplus of £7 million, which was slightly better than planned. As in most situations, and when we're dealing with a £500 million complex organisation, there are some variances that occur during the course of the year. One of the things that we planned to do over the last financial year was begin to improve the amount of private patient income and activity that we undertook. The trust has unfortunately seen reductions in the amount of activity it's undertaken in the private patient space previously, and we had ambitious plans to begin to reverse that and improve upon that. And whilst we did make improvements, we didn't unfortunately reach the levels that we wished to do so. So we had a variance associated with that. We had an overspend in medical staffing, mainly related to the increased cost of temporary medical staff, where we've needed to have them in place to cover either vacancies or potentially short-term sickness absence that we've needed to cover. And we've also had an overspend in our non-pay areas, again, related to outsourcing and clinical supplies. And as I think Miles was alluding to in terms of how well we've done in terms of delivering our activity and achieving our targets, some of that was driven by the need for us to do more work and ensure that work was done in the most appropriate way, either via our own sources or occasionally working with some of our partners across the independent sector to ensure that we delivered the activity we needed to. In terms of offsetting that, the trust started the year with a contingency which it deployed to manage its variances and prudent financial planning. We start the year every year with a contingency which we can deploy. Our requirement to repay our public dividend capital, our PDC, was less than we originally planned by £1 million. And we also were able to release a number of accruals or provisions that we'd made that we no longer needed to be making, and we released a benefit to the position that enabled us to balance off overall. As part of our financial performance, every year the NHS Improvement, NHS England, sets an efficiency requirement that they expect all organisations to deliver. And also on top of that, every organisation has to look at any underlying issues that it may have in its finances and seek to bring it back into balance. And what we do is we look at how we can maximise our efficiencies, maximise our productivity, and work through within our clinical and corporate divisions to identify opportunities to improve our effectiveness. And we look to deliver cost improvement programs to help support the overall financial position. Last year, we delivered 22.4 million, again, slightly better than our plan. But importantly, this was 8.6 million improvement on the preceding financial year. So beginning to further illustrate the financial grip that we have and the sound planning that we have in place. However, it would be fair to say there are some issues still that remain in terms of our financial position. as a slightly higher proportion than we would have wanted were non-recurrent one-off savings, and a slightly smaller proportion, therefore, were recurrent savings that will deliver year on year. And we'll continue to work through that as we move forward as an organisation. The next few slides, I just want to illustrate really two things. Firstly, where our funding comes from, and then secondly, how we spend our funding, what our cost profile is. And it's probably not much of a surprise, as you can see from the exploded pie chart on this page, that the largest proportion of our funding comes from our relationships with the clinical commissioning groups who commission the majority of our services. And as you can see, that just short of 70% of our funding comes via that route. However, another big chunk, just short of 19%, comes from NHS England. And as we're the cancer centre for Kent and Medway, we have a sizable relationship with NHS England, and particularly their specialised commissioning directorate, and commissions the cancer services that we provide. You can see another big chunk comes from other government bodies. That will be organisations such as Kent County Council, who commission our sexual health services that we provide. And also you can see education, training and research and development is also an important part of our makeup, and a very small amount driven from commercial income, the largest element of which is private patients, which I referred to before. But as you can see from here, almost 90% of our, well over 90% of our funding comes from the NHS and other government bodies. When we look at where our expenditure goes, we've shown this in terms of this time as where every pound that we spend goes to give those who review our annual accounts an understanding of some of the component parts. And you can see for every pound we spend, the biggest component of that by far is our staff. Doctors, nurses, clinical professionals providing care makes up the majority of every pound that we spend, 59p in every pound going on staffing costs. The next two big direct items are around drugs and supplies and services, which between them take up another 19p. And then you can see also outsourcing to non-NHS providers as a very small amount, premises. And the other item that's included here is things like our depreciation, our public dividend capital charges, and those other type of items, which are how we fund our capital and also how we support our cash balances going forward. But as you can see here, the biggest elements of our expenditure are going directly to patient-related staffing, drugs, supplies and services. Miles mentioned earlier on in his presentation around our performance, the achievements that we've made around increasing our staffing numbers and particularly our nursing numbers. And if you look at these two slides, you can see that impact in two ways. One, in terms of the overall number of staff we've had working at the Trust. And as you can see that on the right-hand side, where we've got an increased number of substantive permanently employed staff at the Trust, rising from just above 5,000 to just over 5,500 by the end of the year. And you can also see on the left-hand side the proportions of staff that relate to nursing, support staff, medical staff. And again, picking up my point earlier on about the vast majority of those being clinically front-facing, and also an increase in the amount of nursing staff that we've had available within the Trust. Now I'm going to move on to talk about capital and the significant investments in our infrastructure and medical equipment that we've made. Miles has already referenced the new acute assessment unit and also the car parks, which we funded from our financial strength. But we also made significant amounts of investment in capital terms this year, just under 17 million in 1920. The biggest element of that is actually been spent on IT and clinical systems, in particular our new electronic patient record system, which we're on course to go live with towards the end of the current financial year, and also significantly a large amount of work around desktop device replacements, which again we're taking forward in the current financial year that we're working on, where we've made a commitment to begin to radically accelerate the replacement of our aging frontline IT fleet to improve the productivity and efficiency of our staff working on the ground, so they're not left with old computer and old equipment that slows them down. You can see we've also made estate improvements at Maidstone Hospital, including picking up items of backlog maintenance and amending those. The Tunbridge Wells Hospital is a PFI, so we have got some small life cycling works that are taken, but that's part of the process of the PFI. We spent just over, I should say, 2.5 million on major diagnostic equipment, 2 CT scanners at each site, and a replacement MRI and mammography unit at Maidstone Hospital, and a significant amount of money going into medical equipment renewals, which also supported the surgical reconfiguration work that Miles mentioned, and also improvements and expansion in endoscopy, which were also pivotal to our cancer 62-day performance work. We spent some money towards the end of last year on COVID-19 costs, particularly the setting up of our assessment pods, video laryngoscopes, laptops for working from home, and also some first transfer of some additional anaesthetic machines. We were funded some funding in the last financial year for those items. The remaining we have had funding in the current financial year. And I just wanted to finish with a brief outlook for the current financial year 2021, and probably unsurprisingly echoing Miles's comments around the impact of COVID-19 on the NHS. And we've moved very quickly away from the way that the financial regime worked in previous years to a system where it's had much more centralised control and much more understanding of the funding that's taking place, with a real assurance that frontline provider organisations such as ourselves are funded with the funds that they need to provide the services they need when they need them. So we've had additional cash provided to us, additional revenue made available to us, and also if we needed any additional revenue, that's topped up, as the phrase is described, in terms of making sure we come back to a break-even position for the first 6 months of the year. We do believe that the regime will change, or at least be amended slightly, for the remainder of the financial year from October onwards, and we're slowly beginning to understand what that looks like as we move forward. And there's also been some changes to the capital regime as well, with the Sustainability and Transformation Partnership in Kent and Medway beginning to take more of an active role in coordinating and managing the capital regimes across individual providers, and also having some capital itself that it can work with providers and systems to allocate to ensure that we can move forward on really picking up the things that are priorities for us. And I'll probably talk more about that in the coming financial year. So at that point, David, I'll hand back. Thank you.
Thank you, Steve. So hopefully Miles and Steve together have given you a picture of the last fiscal year ending at the end of March, and obviously we're now a number of months into the current financial year, and they've given you some indication of the issues we're facing and what we're doing to respond. The opening slide did show the front cover of our annual report, which is available on our website. If you go to our website and click on the About Us tab, it will be on the publication sub-tab within that. And I would recommend that to you as a more in-depth accounting and description of the work of the Trust over the year 2019-2020. Now we're now going to turn to a question and answer session. The first one I wanted to mention was a comment rather than a question. So we got an email from Councillor Shanila Prendergast, who's the councillor for Maidstone Rural East, saying she couldn't attend the meeting, but she did want to take the opportunity to thank the efforts of our staff through the very challenging times over the last 6 months. I know that we hadn't had any questions in advance. Kevin, have we had any questions during the YouTube screening?
No, David, we haven't had any questions submitted.
Okay. That then leaves me to make any closing remarks. I think, as Miles and Steve highlighted, I think it was a year of continued improved performance by the Trust. And as we sat there in March, we were feeling quite positive about the year-end outcome, and with a lot of plans as to how we were going to continue to improve in the current financial year. And then came the pandemic and the lockdown and the massive impact on our organisation. And I would just like to reiterate what Miles said, the thanks from the board to all the staff of the Trust. It really was a tremendous effort. At this stage, we've stabilised and we don't have any COVID inpatients, either in critical care or on the wards. And as Miles outlined, we are working to recover our services and to try to work on the waiting lists that have accumulated. However, we still need appropriate infection control procedures within our 2 hospitals, and we still need to maintain the contingency in case there is a second surge that causes a higher degree of hospitalisations of patients with COVID. So it remains a very challenging time, and despite an increased flu vaccination programme, which the Department of Health are funding, we may well see influenza problems over the winter in combination with a COVID second surge. So it does remain a worrying time, but our staff continue to step up to the plate and try and get our services back to normal, as near normal as we can, the new normal as it's often described. And the board are very appreciative of those efforts as well. There's a lot of innovation and new thinking going into that effort. So I hope when we sit here this time next year, we can reflect of how we got through a difficult winter and kept the most services going that we could do. So with some trepidation, we look forward to the next 6 months, and please be assured we will continue to do everything we can on behalf of our patients and our local community. So at that point, I'm going to declare the annual general meeting closed. To the board, thank you for attending, and to people watching on YouTube, I hope you found it a helpful summary of the last year. Thank you.